I recognize the member from Hennepin, Representative Howard, the author of the bill, to describe the bill.
Madam Speaker, this is the Alex Smith Insulin Affordability Act, legislation that addresses the crisis facing Minnesotans across the state who cannot afford the insulin they need to live. Members, it's common practice to thank the members and staff that have contributed to such an important piece of legislation, and there are many, and you have my gratitude, but the people I want to start by thanking tonight are the Minnesotans with diabetes that have came to the Capitol, came to us, shared their stories, and fought hard to get this done. Alexis Stanley, who on her 21st birthday wasn't thinking about celebrating, she was thinking about being one more year closer to a financial cliff. She said that Alex's bill would allow her to be excited about her future instead of fearing it. Michelle Camella, who traveled from Thief River Falls to share her story at a listening session and told us she had to skip groceries that week to do so because she had struggled so mightily to afford her insulin. Parents like Leah Greenside and Sherry Wiltrout, who shared with us their greatest fear that their children who have type 1 diabetes would one day not be able to afford the insulin they need. Annette Gentili, who's been to the emergency room several times with DKA, unable to afford her insulin. Nathan and Sherry Laurie and their son Jet, who pay $16,000 annually for the insulin that their family needs, more than their mortgage, more than their car. Maria Isa Perez Hedges, who lives with type 1 and has a 10-month-old daughter, told us that without affordable insulin, she doesn't know what her future looks like. There are so many more Minnesotans that we need to thank. Abigail Hansmeyer, Sarah Ginsburg, Rob Kilborn, Jim and Leslie Farnham, Emma Bommywell, Kristen Hodson, Julia Davidson, Quinn Nystrom, Jason Broback, Malia Camara. I could go on and on and on because there are Minnesotans all across our state begging us to take action because their insulin is simply too unaffordable. And of course, Nicole Smith Holt and James Holt, who lost their son Alec. We heard this story last year on the House floor, but it bears repeating. Alec was 24 years old when he was diagnosed with type 1 diabetes. He was a restaurant manager and made too much money to qualify for public programs, but not enough money to afford the crushing cost of his insulin. Alec needed $1,300 to afford the insulin he needed, and he was waiting till his payday to be able to afford it. And on June 27th, 2017, Alec's mom, Nicole, got the phone call that no parent should ever have to receive, that her son was gone. Alec had $1,000 in his bank account when he died. It is beyond heartbreaking. Members, I told that story last year on this House floor, and we've been saying never again should this happen. But it has happened. Since we adjourned last session, 2 more Minnesotans have lost their lives rationing their insulin. Jessamiah David Scherer, 21 years of age, from St. Louis Park, is gone because he couldn't afford his insulin, and another Minnesotan as well. And what all these stories have in common are courageous people battling an unfair and challenging condition every moment of their day, every moment. They have fear and anxiety about an uncertain future, not just because they need to manage their disease, but because of the financial burden that comes with it. It is so incredibly unfair to them. And this is the reality for thousands and thousands of Minnesotans. Nearly 500,000 Minnesotans have diabetes. And for those who are type 1, they need insulin to survive. It's like water. And the price of a tiny vial of insulin that used to cost $30 now costs $350, a 1,200% increase for essentially that same bottle of insulin. And that's the reason why 1 in 4 Minnesotans are rationing their insulin, which is incredibly dangerous. It's the reason why social media and GoFundMe sites are flooded with people begging for help in their most dire situation. As Jessamiah's uncle told us through tears when he testified, insulin isn't a life-saving drug, it's a life-necessary drug. It's necessary to live, and it demands our attention and action. And that's what Alec's bill is all about. It will create a true safety net for Minnesotans so that never again will someone lose their life because they can't afford the insulin they need to survive. This bill blends good ideas from Democrats and Republicans and is the product of many, many months, frankly, more than a year of work. It's been vetted by patients and providers, and we'll be handing out letters of support from organizations supporting patients, nurses, doctors, pharmacists, hospitals. Virtually the entire care system supports doing something and moving forward with Alec's bill. To spend a little bit of time on what this bill will do, we create a safety net program so that if a Minnesotan is in need and cannot afford their insulin, they can go to their community pharmacy and get an emergency refill that moment. As we know from Minnesotans with diabetes, DKA can onset in a matter of hours if they don't have their insulin. So we need to create an emergent way for folks to access the drugs at their pharmacy, and that's what we've accomplished here. But we also want to connect folks to long-term, affordable insulin. And this bill takes good ideas from Senate Republicans and merges it with the House emergency side to connect folks with the navigator. And so if someone can access an affordable insurance product, we can get them onto an affordable care product. And we also codify language that would cap copays at $30 for Minnesotans whose insulin is already capped on state-regulated health plans. Those eligible for this program are the ones most in need, most at risk, most like Alec. Folks that are earning money that put them outside of qualifying for public programs, but not enough money so that they can afford the crushing cost of their insulin. And we're targeting those that are uninsured, underinsured, and Minnesotans on Medicare. We fund this bill through a shared model. We have about $1 million in state funding and setup costs, and the lion's share of the funding comes from a fee on insulin manufacturers. There are just 3 insulin manufacturers that control virtually the entire global supply of insulin, and those companies have seen their profits soar while the price of insulin has went from $30 to $350. Those 3 companies made $20 billion last year, and this fee would ask a fraction of those profits so they could have a stake in solving a crisis of which they've profited from richly. Kim Munson, whose daughter has type 1 diabetes, shared with us, when you have a disease like type 1, you need people to have your back. Members, we need to have their back. We need to have your back. The Alec Smith Insulin Affordability Act tells Minnesotans that we have your back, that no Minnesotan is going to lose their life because they can't afford their insulin, that your future is yours and isn't beholden to the profits of a broken healthcare system, that we hear you and that we will fight with you to make sure that your future is yours. And members, we all have that chance today to fight along our side our neighbors. And so I look forward to the debate and look forward to us standing with Minnesotans and passing Alec's bill.